Is a respiratory disease like coronavirus, is that correct?
That is correct.
Well, how do you know if you have the flu as opposed to coronavirus?
Well, the definitive test would be to get a test for the flu or a test for the coronavirus. There is overlap in symptoms. The situation with coronavirus is predominantly fever and a lower respiratory infection, as opposed to an upper respiratory infection starting off with, and then you might get a pulmonary involvement, which is flu.
What's a lower respiratory?
Your lung, as opposed to sore throat, sinusitis, sneezing. When you have lung involvement, you can get that with flu, but usually it's upper respiratory and then lower.
So fever and a cough is...
Fever and a cough can be for either of them.
Okay, what should you do if you have fever and a cough?
Well, it depends on the circumstance. I mean, if you're in the middle of a flu season right now and you have fever and a cough, obviously, if you have a cough, it could be a pneumonia. You should see a physician. Certainly, if you're a person in a risk group, elderly or underlying condition, during the flu season, you should see a physician because we do have antivirals for flu, and you can be helped by doing that.
Should we all be wearing masks?
No.
Why?
Because right now, there isn't anything going around in the community, certainly not coronavirus, that is calling for the broad use of masks in the community.
Why do healthcare workers wear masks in the hospital then?
Well, because a healthcare worker who is taking care of someone who is known infected with a transmissible virus, that's different from walking around in the streets wearing a mask.
Are children getting the coronavirus?
To a much lesser extent than adults. And for reasons that are still unclear, it may be that they are getting infected, but their symptoms are so low, they're not being recognized. But in a number of reports that have come out from China, there are very few cases less than 15 years old. You'll always find the exception, but most of the cases are a mean age of about 50.
What can we do, or what can our families do to protect ourselves? What's the most effective thing?
Right now, and I think the question you asked about flu is important. Right now, we are still in the flu season. What you can do to protect yourself against the possibility of coronavirus is the kinds of things you would do to protect yourself against.
Medical consensus at this moment is that the novel coronavirus is more transmissible, but appears less deadly than SARS. Available evidence suggests that the rate of human-to-human transmission of this virus appears to be higher than that of SARS. For now, the evidence also suggests that transmission is mostly via droplets. What this means is that the virus is carried within droplets emitted from an infected person over a short distance, such as when a person coughs or sneezes. If these droplets come into contact with the eyes, nose, or mouth of an individual, directly or indirectly through hands that have come into contact with these droplets, the individual may become infected. To clarify, there is no evidence currently to suggest that the virus is airborne. There are other viruses, such as the chickenpox, which can easily be transported via air currents and do not require droplets to contact the eyes or nose. The novel coronavirus is not in this category of viruses. The novel coronavirus could also transmit through surface contact. Let me explain. When a person sneezes or coughs, the droplets fall onto the surfaces of tables and chairs, for example, and the virus may remain alive for up to a few days. When someone else touches the surfaces of these tables and chairs, the virus can be transferred to his hands, and if he then rubs his eyes or nose without washing his hands, he may become infected. So we should wash our hands. This is also why we only quarantine the close contacts of confirmed cases. For more transient contacts, such as individuals that the confirmed cases may have walked past in malls or hotels, the risk of transmission is low. For coronavirus generally, the person is most infectious when he is displaying symptoms, or what you call symptomatic. There is evidence of limited spread from a person without symptoms during the incubation period. However, this form of transmission may be uncommon and has so far involved isolated cases only. At this point, the evidence still points towards higher transmissibility when the person is displaying symptoms. As such, medical professionals, both overseas and in Singapore, have advised that the most effective way that we can protect ourselves is to practice good personal hygiene. We should regularly wash our hands with soap and water and avoid touching our face with our hands. These may sound simple, but actually they're very difficult to do because all of us touch our face all the time, but are actually very effective in preventing all kinds of infection. Potential infection from asymptomatic persons, in fact, is less likely to be from coughing or sneezing directly because they don't have symptoms. They are not sneezing or coughing, but more likely by touching contaminated surfaces, for which masks offer no protection. Wearing a mask when we are well often gives us a false sense of security instead. And we are more likely to touch our faces when we constantly adjust our masks, which is one way the disease spreads. At the same time, we need to protect others, our loved ones, friends, colleagues, and fellow Singaporeans that we come into contact with. If we are sick, we should rest and recover at home as far as possible. If we do need to go out to see a doctor, for example, we should wear a surgical mask to protect others. So this is when mask is needed, when we are unwell,